Welcome to our evening of our virtual town hall meeting. I'm glad everybody could make it in. It's a wonderful time again for us to come together as Resurrection Parish and to discuss, to gain input and wisdom in how we are, hopefully someday soon, but not quite sure yet, but when we will be able to reopen and have all of you beautiful people back here in these pews. I've been waiting for a while now, and I'm, again, as I said before, I'm getting tired of just preaching to pews. I need to preach and pray with real human beings, so that's our goal. Let's just take a moment in prayer as we begin, and Michelle and Lyle are going to have a beautiful song they'd like to present.
This song is called Shelter Me, written by Father Michael Jonkus, who has written The Beloved on Eagle's Wings. It is a prayer song in the time of COVID-19 pandemic, based on Psalm 23. Shepherd and sheep, my God and I, to fresh green fields you led my steps in days gone by. You gave me rest by quiet springs and filled my soul with peace your loving presence brings. Oh, shelter me, oh, shelter me. The way ahead is dark and difficult to see. Oh, shelter me, oh, shelter me. All will be well if only you will shelter me.
Yet now I tread a different way. Death dogs my path with stealthy steps from day to day. I cannot find your peaceful place, but dwell in dreary darkness, longing for your face. Oh, shelter me, oh, shelter me. The way ahead is dark and difficult to see. Oh, shelter me, oh, shelter me. All will be well if only you will shelter me.
I will look back in days to come and realize your faithfulness has led me home. Within your house I'll find my peace, trusting that in your mercy you have sheltered me. Oh, shelter me, oh, shelter me. The way ahead is dark and difficult to see. Oh, shelter me, oh, shelter me. All will be well if only you will shelter me. All will be well if only you will shelter me.
So Lord, bless us this evening. Gift us with your strength, your wisdom, and the possibility that as we go through this pandemic, that we may have the love and compassion for those around us, as well as the way in which we can come together as a community of faith and hope, whether from our homes, whether on the streets, passing each other in cars, whether grocery shopping, or whether here in our church building. So bless and gift us in this evening. Amen. So I just want to run through quickly what we're going to be doing this evening. The agenda basically is to do this within an hour and 15 minutes is our hope. We're going to have a few speakers that are with us here this evening. We're going to begin with Dr. Scott Ruggles. He'll be here to give a little perspective on the medical side of things. Dr. Scott works with Prevea. John Crone is here, sort of. He's actually at home, but he is being zoomed in, I believe. He's being zoomed in, and Katie's got that under control, so we'll be hearing from him as well. And he works at a local company that he has experience in helping them through their situation with the virus. And also, Father Dan Felton will then speak from the Diocese of Green Bay, and unofficially speaking. He'll explain that as he has his turn as well. Michelle Becker is here as well, and she is our liturgist, and so she'll be able to give input. So after the three speakers, then we're opening it up, and then Michelle will be part of that and giving some comments on the liturgical side of it. Our pastoral council chair is here, Bill Bennett, will be also giving his wisdom and questions along the way as well. Jenny is here, and she's going to be summarizing and giving us the questions that you can bring to us. I believe, if I'm correct, under the screen they're watching now, there is a chat button. So if you push the chat button, right, click it. Okay, so that will activate, and then you can send in a comment or a question, and then we'll get that here, and then that'll feed to us as well. So again, your questions, your comments are very important to us. Just want to say a few preliminary comments. First of all, in that this is not about rushing to make sure that we get things set up so that tomorrow, the next day, or the week after, that we're going to be already set up. We're going to be going with the natural flow. The diocese is going to have the flow as well as when this is all going to happen. We're listening to our state, the governor, and where that's all going. So there's a lot of things that are happening outside. This evening is really about acknowledging that we're in the midst of this virus situation. It's not going away soon. We'll be adapting and continue to adapt. Again, maybe hopefully in a year we'll get this vaccine, whenever that happens, but we will be adjusting our lives during this time as we have in the past. So when we look at coming back into church, it'll be another adjustment in where this is going to go. So the adjustment will be interesting. I found a little cartoon that was interesting that somebody sent me, and just to show that quickly. What can happen when we've been home for a long time, and here we arrive at church. So Mrs. Jones got a little too used to watching online worship from home as she comes in with her little bunny slippers and coffee. So a couple things that we know already, that we're doing as a parish, not just liturgically here for church, but as within the larger parish setting as well. First of all, I got a comment from somebody recently saying, can we please continue to live stream? That is our plan. So we will continue to live stream masses forever, as far as I'm concerned. It's not only helping the situation when you all can't come back here to church to be with us, but we've heard from homebound people and other people who really enjoy coming into what's happening. So people have been listening and watching our daily masses when they get home from work at 7 o'clock at night. So it's all available, and it's being well used, and it's wonderful to give people the opportunity to pray at your own convenience. Second thing is that we're learning all about home study and learning. And within our religious ed, GOD program, adult ed, Church of the Home, those are things that we're developing, again, not just so that when we're all back in church, that all goes away. These are long-term things we're working with, and we'll continue to do so. And finally, we're doing some safe practicing and developing things here in the parish setting, sanitation-wise, and again, whether it's this virus or another virus or the flu, we'll be able to continue to protect ourselves and to do better with that in the future. The big question is, and again, some of you might have plugged into this to find out, what's the date? When will it open? Will we have a better idea? Will we have a better idea after the speakers? We'll find out. But that's something we're going to watch, and I can tell you right now, we're not going to give you a date. We do not have a date. A lot of other things are dependent on it, but it might give you a little better idea of how soon or how a length of time might be there. What I'm hoping to offer you this evening are not everything has been set up and we're ready to go. I'm not looking for that attitude. What I'm looking for is these are very complex situations and issues that we're dealing with. And as we hear them and understand them more, as we are in the news and other situations around the world, we're doing the best we can to pull this together, and we're going to have to adjust. So, in fact, I was talking to my mother the other day, and she's like, "You mean we're not going to just come back to church as we always have? You mean my pew won't be there for me to ready to sit in and go through what?" It's like, "No, Mom, that's not going to happen. A lot of different things are going to be happening that will change things as we adjust." This is a little precursor thing here, and wearing masks. Hint, hint, hint. So again, I'm looking for your suggestions, your wisdom. You've been here many times. What do you know that can help us to stay safe? I'm also looking for your buy-in. It's going to take some compassion, some patience when we do return, and certain things are going to be demanded of us, basically, in order to keep everybody else safe as well as yourself. So again, as we listen to our guests and start moving through this evening, just to kind of keep that in mind. It's not about, I want the answers, I'm going to get it tonight. It's about what are the challenges, what are the difficulties, what are those things we're working with, and how can we piece them together in such a way that we can all be safe as we return to church one day soon. So let's begin with our first speaker. Dr. Rose is going to walk us again through the way in which we can understand this medically from your perspective. Thank you.
Thank you, Father Tom, for hosting this town hall. It certainly is timely, and I hope that we can provide some information. Before I begin, today is Nurses' Day, so I would like to just take a moment to recognize all of the excellent nurses that we have in our community, and we certainly would not be able to make it through this time without their dedication and service. And I would also like to give thanks to the parish staff and all of the volunteers who have continued to bring us Mass into our homes during these past few weeks. I did not look like that in the cartoon every weekend. My job is to explain COVID-19 from a healthcare perspective. My disclaimer is that I am a colorectal surgeon and not an infectious disease specialist, but I, like all of the healthcare providers during this time, have had to learn and adapt and have learned how to take care of patients in an ongoing, safe manner. So what I would like to do is talk about what is COVID-19, how is it different from the flu, and what needs to happen for us to get back to normal. Can you do the next slide?
Next slide, please.
Okay, so here's where we are today. We have this graph that most of you have probably seen from Johns Hopkins. This shows the number of cases in Wisconsin on a day-by-day basis, and as you can see, we're still climbing. Today we hit 8,901 cases, and of those, Brown County has had 1,600 cases. Next slide. This is a graph of the CDC influenza pandemic stages, and from the previous graph that you saw, we are on the upswing of that still, on the uphill side of the slope there in the acceleration phase. So we still have a ways to go to get over the hump. We don't know quite when that will be, but at one point we will be coming down the other side. Next slide. So real briefly, COVID-19 is a respiratory disease caused by the novel coronavirus SARS-CoV-2, and it can present with many different symptoms. The most common one is fever, but chills, fatigue, muscle aches, cough, shortness of breath, and loss of taste or smell are also common symptoms. Next slide. Anyone can be at risk of becoming infected with the coronavirus, but those of older age and those with the other risk factors mentioned are at especially increased risk. Cardiovascular disease, diabetes, hypertension, lung disease, cancer, chronic kidney disease. Most of you have probably heard this before. Males and African Americans are also at increased risk of complications. Next slide. COVID-19 is diagnosed by a test. In the early stages of the pandemic, we had limited testing capacity, and that was part of the reason for the severity of the measures that were taken, the lockdowns and so forth. Recently, testing capacity has significantly increased, and we now have the capacity in Wisconsin to test about nearly, if not over, 12,000 cases a day. And so at this time, the Wisconsin Department of Health and Human Services is encouraging any resident of the state that has even mild symptoms to get tested. And the ways that you can get tested are listed here. It's important to know if you are feeling ill to call first and not just go in. So you could call your provider, you could call or go online and schedule a virtual visit, which is a computer visit with your healthcare system, and they would direct you to a testing center. Or this past weekend, Brown County set up one community site for testing at the Resch Center, and then just yesterday, I believe, a second site at Casa Alba downtown. And for those testing sites, you can register online through the Brown County website, or you can call the United Way 211 number. Next slide. So, as I mentioned, most cases are mild, but up to 14% of cases of COVID-19 can be severe, and 5% can be critical. So, warning signs for which you should seek help immediately include trouble breathing, persistent pain or pressure in the chest, new confusion or lethargy, or bluish lips or a bluish face. Those are signs of low oxygen levels, and you should not delay seeking treatment. Next slide. So why are we so concerned about COVID-19? Why is it not just another flu season? Well, we probably have at least 3 factors that can help answer this question. First, COVID-19 is very transmissible. It spreads very easily. Second, infections from COVID-19 can be more serious than infections from the flu. And third, we have neither a vaccine nor widespread community immunity to slow the spread of this particular virus. Can you go back one? So coronavirus and influenza are both transmitted in droplets of saliva, sputum, aerosolized particles. Most of you are aware of this. They can be spread by coughing, sneezing, and touching surfaces. But research is showing us that coronavirus can stick to the cells of the respiratory tract probably about 10 times tighter than influenza virus particles are able to. Another problem is that the incubation period of the SARS-CoV-2 virus is about 5 days as opposed to only 2 days from influenza. What that means is that you can, if you're infected with SARS-CoV-2, you can come in contact with more people and spread the virus to more people before you even know that you have it. And so what that means is that you can, and what we found through research is that the number of people that can be infected by one person is about twice as much as it is with influenza. You can see what kind of an effect this has had already. For influenza, the average number of deaths per year, we don't like to talk about that, but that is a reality of the disease, is anywhere in the range of 12 to 61,000 cases per year. And for COVID-19, we're in the US, as I'm sure you know, we're already up to over 70,000 deaths just in the last 2+ months. So what we've also found is that the chance of mortality from COVID-19 is probably about 10 to 20 times higher than it is with the flu. Next slide, please. The other problems that we faced early on with this being a relatively new and less common and less studied virus are that we do not have a rapid antigen test yet for COVID-19. We have nucleic acid testing, which is the testing that we were talking about earlier, that usually has to be sent to a lab somewhere. It can take anywhere from 24 to 48 hours or longer. Some facilities are able to do it in-house quicker at this time, but a rapid antigen test, which is available for the flu, can be done in as little as 15 minutes, and it can be very useful in areas where outbreaks are beginning, like nursing homes and schools, to try to contain infections before it spreads out into the community, thereby not having to do more widespread lockdowns. You've heard about some medications for COVID-19. The reality of it is that we really don't have any effective drug therapies yet that are widely available. What we do have are usually reserved for very late in the course. They're not really meant for the vast majority of the public. As you know, we don't have a vaccine yet. It more than likely will be at the earliest early next year, January, before we have a vaccine. And because of that, we really don't have a good way to slow the spread of the virus. Next slide. So in the meantime, we are using what we do have available, which are the infection prevention and control measures that we've all become familiar with. Isolation, staying 6 feet apart, wearing masks. Masking has been very controversial. The idea behind cloth masks out in public is not so much that it protects the wearer from getting an infection, but that it protects those around the wearer from getting an infection if that particular wearer happens to be carrying the virus and has not yet developed symptoms. So in the healthcare facilities, we already are doing a lot of these things. Masking is universal at this point. The healthcare facilities are very safe. We have measures and procedures in place to separate well patients from ill patients, and it's very safe to come into the hospital right now. So where are we going? How do we get back to what we're familiar with, what seems normal? You're probably familiar to some degree, or have at least heard about the Badger Bounce Back Plan, which is Wisconsin's plan to move forward. It is shown here, and at the bottom left, the red circle is where we are right now. The idea is that we move clockwise around the dial to the green circle in the lower right. And to do that, we have to go through several steps. The first things that have to happen on a state level is we have to have access to more testing. We have to expand contact tracing, and what that means is we need to call, or employees of the healthcare department, local healthcare departments need to be able to contact everyone that has a case of COVID-19 and subsequently contact everyone that they've been in contact with to try and get those people tested and treated and isolated. We also have to track the spread. That means know which counties are hot areas and need more attention. The state is still working on developing those tracking measures, and we have to have more personal protective equipment, and we have to make sure that the hospitals can take care of surges in cases. As far as the PPE and hospital capacity, we are pretty well set on that right now. Next slide. This is just a picture showing how our testing capacity in the state has increased. We are, like I mentioned, up to about able to do 12,000 cases a day now. A couple of months ago, we could barely do 100. Next slide. And so once we have all of those core measures in place, so to speak, I guess, we have to go through what are called gates. And this is a picture of the gating criteria, all the gates that have to turn green before we can move to the next step. This actually is a slide that I pulled up on Monday from last Friday. So what it's showing are that over a 14-day period, you have to have a downward trend of symptoms, and you also have to have a downward trend in the percentage of cases that are positive with respect to all of the cases tested. And you have to have certain measures in place in the hospitals, previously mentioned, adequate staffing, adequate capacity, adequate critical care services available. So as I mentioned, that was 2 days ago, and the good news is that, next slide please, we have some green dots now. We have seen over the last 14 days a downward trend in the number of flu cases or flu-like symptoms, but next slide. This slide is showing the number of cases that are positive out of everyone that's tested, and that number unfortunately is still going up. So we will need to be waiting at least another 14 days for that number to go down. Next slide. And like I said, when all of those gates are open, when all of the dots turn green, then we are able to move to the next phases of the Badger Bounce Back Plan. Currently, we're in the left column, the Safer at Home column, and again, when all of the measures are met over a 14-day period, we are able to move to the next column to the right. So our next phase will be phase 1, and what that means for us as a parish community is, unfortunately, we will not be able to come back to Mass just like it was before. As you can see on the bottom row there, that's a line that points to what's allowed for religious gatherings, and for the next phase, we will only be able to gather in groups of 10 maximum. When we get to that phase, we'll have to start the whole gating process over again and make sure that things don't get worse. And all of the lights will have to turn green for another 14 days before we can move to phase 2. And the final phase is phase 3, which you can see at the bottom corner there is when we can gather in Mass without any limits of numbers. So, next slide. So what has to happen, again, in summary, to return to normal? We have to have significant personal protective equipment supplies, masks, adequate hospital capacity, widespread testing. We are doing pretty well on those measures right now. We need a rapid antigen test to control outbreaks or identify outbreaks. We need better drug therapies. We need a vaccine, and we need widespread immunity. And the good news is that we are rapidly moving in that direction, and we will be there at some point. Things will probably, some of the measures that have been put in place will probably remain, but I feel very confident that we will be getting back to normal relatively soon. Thank you.
So just a quick comment, Scott, as long as you still have the mic. As we're hearing more and more from different pressures and let's get back, businesses opening, life going back to normal, before some of those trends are on the downside. I mean, it's common sense, if we push too quickly, the numbers are going to go back up again, right? And it just keeps pushing it back further and further out.
Well, right. That's the idea behind this plan, is that by doing it slowly and monitoring, it may be that we have to go back to one of the earlier phases and more restrictive measures. The other problem that you run into is when certain areas are opening faster than others, inevitably there's going to be some travel across the areas, and that could affect the number of cases that climbs in one area and in another area.
Good, thank you.
It's very important to go slowly and safely, but if we do it that way, we will. I have every hope and every belief that we will get back to normal at some point, and
right.
Hopefully it won't be too long.
Right, thank you. And that was my initial comment, was we're not rushing. This is not about rushing. This is about informing, gathering wisdom, and then making those set plans so that we can be ready when it is appropriate. One of the things, the early outbreaks that seem to have come out of, that have allowed the virus to grow and spread quickly, were weddings and funerals. Seemed to happen a lot when people gathered initially, and all of a sudden everybody's around too close, and then they go home and they go to work, and that's the quick spread. So we're part of that. Weddings, funerals, gatherings like this in church, we need to be nervous. We need to be careful in how we do so. So thank you, Dr. Scott. Getting a little bit more into the practical end of things, John Crone is here, and he works at Schneider. He'll explain a little bit about what he does there, and he has going to give us some practical things of what Schneider company has had to do and will be doing to keep their people safe as well as they are at work. We're queuing him in, and he will be with us shortly.
Just let me know, Katie.
I can keep talking. Okay, actually I will.
All set?
There are a couple things that I was going to share later, but I can share them now to give us a little preview of what we're doing already and what has been done here at the parish. And these are preliminary things that, again, we could have been doing them all along, and we're just catching up now to be ready for this one, what's happening here. One of the things we've already figured out and will be doing is all of the missalettes and hymnals are out of our pews. Again, from one mass to another, to people touching the missalette and putting it back in the pew. That is obviously a possible contagion. Our pews, kneelers have been cleaned, sanitized. Anybody coming in, like tonight, we'll be going around and disinfecting again. Our carpets have been fully cleaned. We're replacing some older-fashioned towel dispensers in our bathrooms. We have some, I think, from the 1950s that you had to like crank it, and Okay, now we're going to the no touch. Again, just to keep everything as safe as we can. We're getting some indications for down the aisles. Every 6 feet will be marked. That's another thing we're looking at. We're looking at getting the bathroom faucets, water faucets, to be hands-free. And also we've been looking at changing out our doors. These are the original 1960s doors here on these two sides, north and south, and so we're looking at that, and they would also have a power assist to come in. Again, next week, Tuesday, our safety committee and a few of us from the faculty, from the staff are going to be meeting and discussing more steps that we can take as we go. So we are ready with John. I spoke long enough. John is ready.
You ready? Okay. Well, hello, everybody. My name is John Crone. Again, good evening, and thanks for joining us. What I'm going to do today, or tonight, I should say, is I'm just going to give you a little bit of perspective on what some companies are doing. I'm going to talk about our company, Schneider, which you know is a trucking organization. So I'm just going to help you understand kind of two facets of what we're doing. First facet is, what are we doing right now for our associates? You know, all this came to fruition within the last 6 to 8 weeks. What I'm going to do is show you what we're doing now, and then I'm going to show you what we're planning on doing. And the planning on doing, what Father talked about was, when is this going to happen? What we say at Schneider is, it's going to be data, not dates. So when are we going to start returning to the workplace is what we call it. So what I want to do is just kind of walk through a quick presentation. I'm going to share my screen with you, and let me know if you see it. You see it? All right, very good. So the first thing is, what are we going to do for our associates, right? Now, well, the first thing we did is, Schneider traditionally has been a you come to work organization. We have completely flipped that around. In a matter of about 2 weeks, a large percentage of our people worked in our buildings. Now a large percentage of our people are working from home. So that was the first thing we did. The next thing we did is, for the people that couldn't work, their job required them to be in the building. What we did is, first, we put out a lot of communication and a lot of signage to talk about what are the social distancing best practices, what are the things you should do, what shouldn't you do. We went to a collaboration tool very similar to Zoom, or what I'm using, Zoom here, instead of face-to-face meetings. We also provided all of our staff, including drivers and office staff, shop, mechanics, everything, with masks, disinfectant wipes, and also hand sanitizers. The other thing we did is, we did some enhanced cleaning of our buildings. And what that means is, we went to places of high traffic. That could be doorknobs, that could be copiers, printers, things like that. And we're cleaning them more often with cleaners that are approved by the CDC. And the last one, and what we're doing here today, and probably one of the more important ones, was communication. And what we did with communication is, we made sure all 19,000 people in our organization knew what was going on, what the plans were, where we're going, where we are. So that's kind of what we're doing now. This is what we're planning on doing once we return to the office. So as Father said, this isn't going to be, we're going to open the doors and people are just going to, come back as normal. We're going to phase in. We're going to phase in, we're going to start small, and then we're going to slowly advance and see how things progress. The other thing is, we're going to change how people come into our building. So as an example, you're going to enter through a certain set of doors, and you're going to exit through another set of doors. And what that does is, it prevents people crossing in vestibules or doorways. I think you've seen out in Green Bay, there's some organizations, I think Walmart does this, Sam's does it. this is just a way to help prevent some, cross-contamination type things. When you talk about social distancing, one of the things is when you're in an organization, the cubicles are somewhat close. We are going to stagger seating, which means we're going to leave a cubicle or whatever they're in, we're going to leave some open so that we can keep the social distancing correctly. There's also things that we're going to do in common areas, let's say reception desks. We're going to put demarcations, if you will, lines on the floor. But we're also going to put up some type of barriers to make sure people don't get too close to desks that help either our drivers or reception desks or whatever. So we're putting those in place to kind of protect our associates and protect the people in those roles. The other interesting thing that we're going to do is we're going to reduce the capacity of our conference rooms and cafeterias. So we have conference rooms that can take 20 people. Can sit in there. We're going to reduce those to like 6 chairs. So or 5 chairs, whatever the right number is based on the volume, so that people can't sit very close together. You have to naturally do it. Same thing with our cafeteria. And speaking of our cafeteria, we're installing plexiglass partitions so that keeps both the workers that work for us in the cafeteria, but also the people that are buying food there. And the other thing we're doing is we are, prior to coming back into the office, we're going to what's called deep cleaning. We're going to deep clean all of them based on the CDC guidelines. So high level, and again, I wanted to make this quick. High level, that's what we're doing from a Schneider standpoint. So that's all I have for now.
All right, thank you, John. Appreciate that. I think as John, you mentioned that if we go into various stores, situations, supermarkets, we're already seeing some of that. There's the lines on the floors. We're seeing some barrier partitions happening between the cashiers and as we check out and our food. And John, your wife does what for our parish? Mary Jo does what for our parish? Oh, never mind.
Well, I think Mary Jo is the receptionist, but I always tell her she's kind of, when people come into our parish, she's kind of the person they meet. So she's kind of I don't know if it's the face of res sometimes.
Correct.
But, I obviously am concerned about her from she interacts with so many people. So, any protection we can do for her, obviously that would be great. But she's kind of the first person you meet when you come into the parish.
Exactly. And so we are looking at plexiglass as well to kind of partition off the front desk there so that there is a plexiglass type of barrier between the person behind and the person in front of the desk there. So again, what's important that John has shared with us is that what you see basically out there in the public now is going to have to come here into church. It'll be adjusted a little bit for our situation, but he's talking about staggered seating. We're going to have people staggered in the pews in different situations, in different configurations. The lines, again, 6 feet lines on the floor, every 6 feet. So as you go about your normal life as far as shopping and stuff, as you see that happening there, do not be surprised because that's what's going to be happening here. We're going to be dealing with the doors and coming in and out, all the things that, again, that will keep us safe and keep us moving in the right direction. So thank you, John. Appreciate your help. And again, we'll be having some more questions. You might come in a little later. Father Dan, if you want to tell us a little sense of where the diocese is at this point.
Great. So let me just kind of bring you up to date. I'm sure you're very interested, especially given some of the news that we've had recently. The bishops of the state of Wisconsin have been meeting. They've been talking with one another as to how, in a way that is bold in faith, but very prudent in safety, we might move back to that place at a particular time of being able to celebrate Mass publicly, because we've been celebrating Mass, but it either has been online or it's been streamlined, and or every priest in the Diocese of Green Bay has been celebrating Mass privately on behalf of you. However, as the bishops are talking with one another, they're acknowledging that there may be some things that we can do with a certain sense of uniformity between the 5 dioceses of the state of Wisconsin. And yet at the same time, they're also acknowledging each diocese kind of has its own characteristics. For instance, Bishop Powers up in Superior, the Diocese of Superior up north, he's acknowledging that the CDC and their health officials are telling them probably in the Diocese of Superior that we're going to see the coronavirus peak sometime in mid-July. And so they will be kind of following behind, perhaps where we have seen that peak elsewhere in the state of Wisconsin. Recently, as the bishops were talking with one another, Archbishop Listecki in Milwaukee last Friday released a plan for the Archdiocese of Milwaukee to have a comeback and ultimately, in a very limited kind of way, to be able to come back to celebrate Mass publicly on May 31st. And they would do that by 25% occupancy of the church would be determined. That would be the number of people that would be allowed in. And at that point, then, they would celebrate Mass with those who had gathered, respecting a 25% occupancy in the church. That is for the Archdiocese of Milwaukee, but that necessarily isn't going to be the case for the Diocese of Madison or La Crosse or Green Bay or Superior. Each bishop in his own diocese will have to take a look at what's happening there, what's particular and unique to us. For instance, Brown County here in our own diocese is spiking. We're a hot spot at this time. And then each bishop will make a deliberation as to what is best for his own diocese and for the flock that he tends to and for the people that he serves. There just have been some general guiding principles we've been using since the very beginning. And I'm going to summarize those for you kind of at a 5,000-foot level, and then we'll dive down into some of the details. First of all, from the very beginning, our diocesan leadership and our parish leadership, we have strongly been encouraging that we monitor and measure, that we monitor the real numbers, the data that's being presented to us, the real experience that we're going through, that we monitor that, and then we respond to that, or we measure what is an appropriate response to whatever that we're monitoring. And so as we've been moving through all of this, it's been to monitor what's happening, what is the data that we're getting, and then how do we give a measured response to whatever that data is, whatever that experience is. For the bishop here in the Diocese of Green Bay, Bishop Ricken, he is very committed to flattening the line. And so he really does see that as being an act of justice, an act of responsibility that we must have as our faith is bold, but as we are prudent in our safety as well. And so flattening the line, and I'm sure you're familiar with that saying by this time, has been a very, very important item as we have monitored and then we have measured a response. Also, we have found ourselves kind of trying to do a 3-prong approach. How do we accompany people through all of this? How do we stabilize things in the midst of all of this? And then ultimately, we even have to begin planning how are we going to re-engage our parishioners as we kind of move through this and begin slowly to move out of this. And I would encourage people here at Resurrection to be you all have been doing the first 2 things and even to begin to think about the third thing. So we've been trying to accompany each other in so many ways, trying to stabilize things. That's some of the materials we're covering tonight. But then how are we going to begin to re-engage people? I would also say the bishops of the state of Wisconsin are very deliberate and they are very committed that they are going to gradually introduce how we might get back to a public celebration of the Mass and the reception of communion. The governor has set May 26th for Safer at Home. We know that there are some things going on right now with the Supreme Court that could have an impact on that date of May 26th. Regardless of all of that, regardless of the governor's date, regardless of whatever Supreme Court ruling might be, and the establishment of another date or another approach or a manner, the bishops of the state of Wisconsin says that doesn't make any difference at all, that whatever way that we're going to go back to a regular reception of communion and the public celebration of Mass, it's going to be gradual, it's going to be intentional, but it isn't just going to be set up and controlled by some of those other variables and factors that are around us. So with that said, Getting a little more specific, there are various approaches that we could take as to how we slowly engage in receiving communion and ultimately the celebration of the Mass publicly, and how we gradually do that a step at a time. Do it intentionally, but do it gradually. So one of the options, and again, you have to be very careful. I'm going to share with you some ideas and options, but if you leave here tonight and you go home and you say, this is what we're going to do, this is how we're going to do it, you did not hear me say, nor did you hear Father Tom say at the beginning, these are just some ideas that are being floated, some options that Bishop Ricken is looking at as we begin very intentionally, but very gradually, step by step, to re-engage. So one of those options would be to have communion outside of Mass. So a lot of times people are saying, how come we can't gather here in the church, but you can go to Menards and you have people in Menards, or you have people in other institutions like Menards? Well, one of the reasons for that is that even though we are an essential business, churches and funeral homes have a further restriction on them as an essential business. And that is, the idea is that Menards, you would stream through the store, you come into the store, you go to get whatever it is that you want, you stream through, you get to the cashier, and you stream out. Churches and funeral homes typically don't stream. Typically, we gather, we congregate, we come together in a space. And so one of the things that Bishop is looking at as an option is if we did communion and the reception of communion outside of Mass, and that is a rite within the church. So it's a ritual that we have available to us in our heritage and in our tradition. But if we did some form of receiving communion outside of Mass, it could allow for the fact that 8 people with proper spacing could come into the Mass after a streamline or after watching Bishop on TV on a Sunday morning on Channel 5. They would come into the church, they would be spaced, there would be no gathering in the gathering space, it would just be coming in. A very short ritual, people would receive communion, they would immediately stream out of the church. So it kind of would be our streaming of communion and the official rite that we have called communion, receiving communion outside of Mass. So he's kind of looking at that particular option of one way of responding to your need of giving us feedback over and over again. We really are missing the Eucharist. We're really missing receiving communion. We're missing the Lord Jesus Christ. That might be an option, and he's considering that at this time. Also, with phase 1, as also has been mentioned by Dr. Scott, we would be moving to 10 people and then kind of figuring out what does that mean in phase 1 as to how we might be able to celebrate Mass publicly in a somewhat limited way, but perhaps in a little bit different way. Another option is what Milwaukee is doing, and that is actually going on, not so much the numbers that are a part of phase 1, which is 10, phase 2, which is 50, but going on some number calculated by the occupancy in the church itself. Regardless of whatever those options are, as gradual but next steps that are very intentional to receiving communion and celebrating Mass publicly, once we're in the worship space, there's going to be the same thing no matter which way people might be gathering and no matter what number that might be. And some of these things we've already covered and some we've not, so I'm just going to very quickly go through them so we can get to your questions and answer your questions if possible. So just some general things. The obligation to attend Mass would continue to be dispensed until further notice. So even when we have the capacity for phase 1, even when we have the capacity for phase 2, even when there may be more people come, even when we have phase 3, which basically opens things up to the new norm, there are going to be people because of health restrictions, there are going to be people because of fears, whatever the case might be, who will not want to congregate back in spaces where there's going to be a lot of people gathering and risks that will be heightened because there are a lot of people gathering. The bishop would never want, the church would never want somebody to feel like they were doing something wrong in that particular situation if they're following their conscience. So by dispensing of the obligation to attend Mass, it kind of takes that pressure off of people and allows the freedom for people to engage in a way that they feel is safe and is right for them in their relationship with the Lord. Likewise, as we move in these earlier stages, whether it's communion without a mask, whether it's phase 1 with 10, phase 2 with 50, or a certain percentage of the occupancy. Those who are at risk really should not be coming to church and gathering in any one of those scenarios that I just described if you have any health conditions or because of age. Now I can say that age thing and not be discriminatory, because guess what? I'm falling in that age thing now. And so anybody who would be 60 years of age or older really are discouraged from gathering for that kind of communion outside of Mass, or for phase 1, for phase 2, just because of the elements of risk that are taken. Likewise, the same is true for our priests. And so for our priests who are 60 years of age or older, the bishop will be in a conversation with them. What is your health condition? What's your background? What are the risks that you're taking? And it may be that for the phases that we're talking about, a priest may not be able to celebrate those kinds of rituals because of the risk to them as well. As we've already talked about, hand sanitizer will be used regularly in a number of situations. We will be using masks. And so for any of the options that I just looked at that the bishop may be looking at, we will be wearing masks. Most likely we will also be taking temperature of people who are coming to the worship space and into the church. And as many of you are well aware these days, temperature is not taken by putting that thermometer in your mouth, but by very simply pointing an instrument at you without ever touching you, but it is able to give an accurate reading of temperature as well. And so for the safety of those who are gathering, there would be most likely some temperature kind of taking. For sure, there are going to be masks. The doors will be open. The least amount of times that we can have people touching doors and handles on doors and all of those kinds of things, doors will be open. No waters in the fonts of any nature, certainly not in the baptismal font. No socials or anything after the Mass. Again, any congregating or gathering together for the pre-phase, for phase 1 and phase 2, just does not work. It just does not work because we're trying to keep that social distance.
So, Father Dan, are you saying that we cannot have coffee and donuts for a long time?
No coffee and donuts, at least for phase 1 and phase 2.
Ouch.
So, and I know we're all, there's two things that we're missing. One is three things we're missing. We're missing Christ, and we're missing communion, and we're missing community. And you put all of those things together, and one of the aspects of community that we're really missing is just the opportunity to kind of gather and to be together as well. So when it comes to being in the church as well, some practical things, very specific things. Father Thomas also mentioned everywhere that there's got to be 6-foot distancing. Certainly that will be marked out ahead of time. When we come into the church, probably it'll be every third pew that there would be an allowance for seating. Everything else will be roped off. If you come as a family unit, you could sit as a family unit together, but outside of that, the next person or the next family has to be 6 foot in distance. Ushers are going to kind of be responsible for kind of coordinating that and making sure that people understand that and where they may be able to be seated as ministers of hospitality. Anything that has to do with coming up communion, anything that has to do with confession, all of those markings will be on the floor as well. Probably at the end of Mass, again, we do not want to congregate. We do not congregate in the gathering space when we come in. We don't go out into the gathering space and congregate. We don't go into the parking lot and congregate for pre-phase and for phase 1 and phase 2. So more likely than not, many churches and parishes will actually dismiss people at the end of the Mass, which is kind of the Mass is ended, go in peace. But as you leave, it'll probably be by some specific rows to just make sure we're not sending people out in groups where it's going to be a natural inclination to just find ourselves gathering whether we want to or not. There will be a plan that you need to develop for the restrooms. We can't have 5, 6 people in a restroom at a time, and there'll be some guidelines for that. Choirs are discouraged, so choir members will be close to each other. Also, when we sing, we are projecting that which is coming out of our mouths, including all of the elements that Doctor was talking about earlier. So for phase 1 and phase 2, we would really be discouraging any kind of choirs as well. To the extent it's possible, all of the ministers up here in the sanctuary area, when we're gathering for some phase 1 and phase 2, should maintain and figure out ahead of time social spacing and how we might be able to do that. There are so many little things, adjusting an ambo mic, one hand reaching up there to do that, the next hand reaching up there to do that. We got to figure out ways that if we got to adjust that mic, that we clean the mic from the last person before we place our own hands on that mic. As much as is possible, it's already been mentioned, no paper. No paper. Paper it holds on to the virus longer than other elements. So no hymnals, no bulletins, no compass, no paper. And if you do have a sheet of paper, maybe for like phase 2, then a 1 page or something, people would have to take that with them as they leave so that there's no paper that is left behind. After each service would be done, any space that has been used has to be sanitized. So it's not like we're going to sanitize that after the second service on a Sunday morning. After the first service on a Sunday morning, everything has to be sanitized. After the second service, everything has to be sanitized as we move through this, which means we have to pre-plan for supplies, how we're going to do that, people that are going to do that. Offertory procession, no gifts would be brought up. That would be omitted. For the collection, we're still taking a collection, so don't think the coronavirus is going to get you out of your church support and your stewardship to your parish community. However, it's no passing of the baskets. If we do not have long-handled baskets, then there will have to be baskets put in the places where people exit so that they are able to place their stewardship giving in those baskets as well. There will be no invitation to share a sign of peace with one another for the pre-phase, for the phase 1 and the phase 2. Precious blood would not be shared for those phases or for the pre-phase. Also, when it comes to the distribution of communion, it is encouraged that communion would be in the hand. We can not deny somebody communion if they would like it on the tongue, but we really strongly encourage people to make the sacrifice and to receive it, to form a throne, to be able to receive Jesus in communion with your hands. And if for whatever reason a person does exercise that right to receive on the tongue, then the priest will need to sanitize his hands after he has given communion on the tongue before he would continue with communion and the service itself. In terms of the faithful, at the end, as I mentioned to you, it'll probably be a dismissal that's a little more ordered than we might be accustomed to, because the whole idea is, even though we're congregating, we're kind of just fluid as we're coming in, we're celebrating, and then fluid as we are going out. So that's kind of where we're at a 5,000-foot level, some of the options that Bishop is looking at. We will have a meeting with Presbyterial Council, with our regional vicars, and be talking about that. Probably something will be coming out soon as to what are we going to do for the pre-phase, what are we going to be doing for phase 1, what are we going to be doing for phase 2 before we ever get to the phase 3. So thank you.
Thank you, Father Dan. Again, that's a lot, right? Michelle, I'm going to come to you in a minute. I just want to get some reactions liturgically, what your sense is, and how we kind of move this forward as well. Bill, do you have a comment or question or something that? Sure. Why don't you come over here and use the ambo? Yep. Cross trafficking and getting people too close to each other. That's what we're doing, trying to avoid.
Thank you very much. I want to thank, on the behalf of the Pastoral Council, thank all of our presenters today, Father Tom, Father Dan, Dr. Scott, Michelle, and especially to our staff that has been working so diligently for the parish. Difficult times for all of us. We yearn to be back at church with our community, to celebrate Mass, and most of all, to receive Christ in the Eucharist. I think so many of us yearn for that. And we don't realize how much we need something until it's gone. And I've spoken to so many people that really miss coming to Mass and receiving Christ. So I'm glad to hear that the diocese is so diligently working on this. You know, our church is open. Our buildings are just closed, and our community gatherings are not happening right now. But at Resurrection here, we have so many resources. You go to gbres.org. Our staff has done a wonderful job with flock notes. You get daily readings. You get ideas, what you can do with your kids and your teens and family gatherings, health-related issues. So I suggest that you go to gbres.org, sign up for the flock notes. Plus, you get Father Tom and Ruby every day. So I'd like to thank again everybody for this. And like I say, the church, Father Dan said, we still have needs here at Resurrection. So our giving online, for our sacrificial giving, and for our outreach programs, everything is still intact there. And so we still do need your support. So thank you very much.
Thank you, Bill. Appreciate that. Michelle, do you have a comment?
I just would like to say this is all very heady and heavy, and I would like to just speak to the heart and say that we hear that phrase, we're all in this together, but sometimes it doesn't feel like it and we feel alone. So please come and reach out to us. We say we miss our friends, reach out to them. We are working together, it will be fine, but sometimes we just need a little companionship. So however you can do it safely, reach out to each other. God is with you. Your place, you are on holy ground at home, and we will be so glad to welcome you back. But meanwhile, trust that God is with you. Reach out. And I remember my mom saying, offer it up. And I think our church is steeped with sacrifices of Jesus and many others before us, and we are just joining with this big communion of saints together. So that's my comment.
Very good. Very good. Thank you, Michelle. Just a couple comments. There's about 100 of you watching now, and this will be available for others to clip in and what's happening.
It's your battery.
And when something should not go wrong, it goes wrong. So we're losing battery or something. Just a couple comments. Again, about 100 of you are watching now, and this will be available, correct? If anyone wants to plug into it later, it can be watched over the next couple days. A couple things that I've been just noting, and we can close with this, is that, first of all, we need, as Michelle just said, we need a lot of patience. We need a lot of understanding amongst and between ourselves. We need to go slowly in how this is unfolding. One of the things I picked up is that the sooner we open, it seems, the more restrictions we're going to have. So if the virus is still climbing and it's not overly safe out there, we have to be even more safe inside. And again, as I started out, I think it behooves us just to go slowly, be patient, and not rush. With that said, I think it's been an amazing experience for many that I have spoken with out there, is as we put out in our flock notes, our emails going out every day, we call it the Church of the Home. And I think this is a beautiful opportunity for us to realize that, yes, it is a very Catholic expression of who we are as we gather for Eucharist and receive the host of precious blood, that we receive the body and blood of Christ. And, which is true, absolutely, and what's happening in your own personal heart and soul. How have you seen over these days not being able to gather here as church per se, but what has that done for your own inner spirit, your own presence of Christ in your own heart and soul, your own responses out in the world? How has it and how can it continue to deepen in that sense of Christ? And also I've been hearing a lot of things of how wonderful it is to actually be able to hang out with the kids and to have opportunities to do things with family, and especially to pray with the family. And in our busy lives, and we're zipping in and out, we don't always have that opportunity to stop and to reflect and just take in what's there in front of you. And so yes, we have that desire, as I do, we want to come back. And the reality of where we are is that we get to, in a very positive way, settle into who we are in our homes, in our hearts, in our relationships with family and friends. So take advantage of that. That's a good way to be patient and to just do our waiting well, is just to be in where we're at and ask for Christ's presence in those moments as well. As Father Dan said, our safety and the safety of our community is primary with Bishop. And again, I absolutely agree with that. I would have a very difficult time as pastor here to open our church sooner than what seems necessary and or seems safe. I really would have a hard time all of a sudden if Resurrection Church Parish becomes a hot spot. And all of a sudden we are targeting people and thinking, okay, you've had it here, who have you spoken to, who have you been with? And all of a sudden the health department is circling around us saying, wow. So again, how do we be patient? How do we make sure we have everything in line with what needs to happen? The other thing that to keep in mind is that as we've been hearing, there's going to be a lot more regulation happening. It's not going to be kind of that free flow sense of I come in the door, I talk to the people over here, I come through into the church, I find my pew, wherever that may be, or my pew, and then I go through the Mass and do the same thing going out. It's going to be challenging for many of us to be told what to do. We're going to have people, and I hate to put this on the ushers, and the ushers are not going to be happy about it either, but they're going to have to, and we're all going to have to somehow start regulating, this pew is open, I'm sorry, that one's not open, and you cannot stand so closely, and reminders of this is going to be happening, and we're going to do the best we can, but it's going to be there. So again, just keep in mind that life will not be the same for a while. And with that in mind, as far as whether there's 25% of the pews filled or 50 people or whatever it is, we have to regulate somehow that people will know when to come at what Mass. If we don't do anything like that, and there's a suggestion out there even having tickets or somehow having certain people will be coming in for the 8:30 Mass on Sunday, other people will be assigned to maybe Friday morning Mass. So it's something we're going to have to work with, and it's going to be challenging again to do that, but it's necessary. The alternative is to just have our Masses open, and we're going to be able to receive, let's say, 75 people in church. Well, the 76th person and everybody else is going to be denied access, and somebody's going to have to tell people, I'm sorry, you can't come in. Please come to the next Mass or whatever. That's not a situation that I'm hoping we have to do, at least to a large degree. So we're going to try to figure out some way to do that. I've talked to a number of people who have been saying, I don't need to come back soon, and especially, again, as we talked about the elderly, to make it very safe and have a good sense that it's okay to stay home and to not come in. So those are some of the things that we're working with and needing to work with before to get ourselves ready, as well as to figure out what is it going to be like when you do arrive, and how is that regulation going to have to serve us well as we come together for the Eucharist.
I think along with that, Father Tom, and as Doctor was talking about as well, and John made reference to it, that we're talking pretty much a lot about the pre-phase and phase 1 and phase 2. Mm-hmm. And even though when phase 3 comes and it kind of is back to the new norm, it's going to feel a lot more normal than it is right now. There's going to be some things that are just going to pretty much become the fabric of our cultural experience, but the pre-phase and the phase 1 and the phase 2 is going to, over a period of time, get us back to that place where we still have to be safe and we still have to be aware of the fact of some distancing and things, but it's not like phase 1 and phase 2 is forever. Mm-hmm. Those are necessary, gradual steps, as you are saying, Father Tom, to getting us to phase 3, which is basically kind of a reestablishment as being much more familiar than phase 1 and phase 2 are again.
Right.
Otherwise, we might lose hope thinking this is the way that it's going to be forever, when in fact those are the intentional, gradual steps getting us to that place of phase 3.
Right.
Right, Doctor? Yeah.
When we have a vaccine, we'll be very close to normal when we have a vaccine.
So the vaccine is really the key to putting us all back together again, right? So that's our hope and prayer, is that that vaccine can come forward and can move forward in where we're at. So anything else that any of our experts, people here?
We can do this.
We can do this. It can happen. We'll do it together. And again, with our love, compassion, and walking together in this, we'll be fine. I just want to close with a prayer and talking about, as Father Dan just said, when this is over. There will be an over. We will be gathering. We'll find again, not the same normalcy as we had last year, but a new normalcy, normal that will take us into the future. And so the prayer poem goes like this. When this is over, may we never again take for granted a handshake with a stranger, conversations with neighbors, a crowded theater, Friday night out, the taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, that we were called to be, that we hope to be. And may we stay that way, better for each other, because of the worst. So during this month of May, let's pray a Hail Mary together, just asking for that presence of Christ, the presence of our God to be with us, to bring us into the wisdom and the hope that we desire. Hail Mary, full of grace, the Lord is with thee. Blessed art thou among women, and blessed is the fruit of thy womb, Jesus. Holy Mary, Mother of God, pray for us sinners,
now and at the hour of our death. Amen.
Again, thank you to our speakers. Thank you for all of you for joining us. And again, watch for more communications that are going to be coming out, and we'll be following in this and working together into the future. God bless, and good evening.